Excited to be here today to discuss a critically important new development in our efforts to keep our kids safe from COVID-19. But first, I want to recognize all of you for your continued participation in this work group. You dedicated much of your time and energy over the past 2 months to keeping our school kids, teachers, and staff safe from COVID-19. All of Kansas is grateful for the work you do each and every day. I'm especially grateful for your willingness to serve on this Safer Classrooms Workgroup. The work group has had frank discussions about the impact COVID-19 has had on our kids and our schools. You've discussed the importance of the Kansas Test to Stay strategy, a growing program that is allowing kids to stay in school and minimizing the spread of the virus. You've highlighted the Kansas data that demonstrate that schools without mask requirements are over 4 times more likely to have an outbreak. You've shared your concerns about students' mental health status, a concern I share. And finally, you have addressed the dangerous effects of misinformation about COVID-19 and the need for healthcare providers to share accurate and timely information with parents and families. But I'm here today to discuss one particular topic you have prioritized every week, that the most effective way to stop the spread of COVID-19 is through vaccination. And finally, after many months of research, tests, and trials, late yesterday, the CDC authorized a COVID-19 vaccine for our kids ages 5 through 11 for emergency use. We have been anticipating this exciting development for some time. The Kansas Department of Health and Environment has been preparing for months to rapidly respond when this announcement was made. In the first wave of vaccine distribution, Kansas will receive 128,000 doses. Some doses have already arrived, and we expect most to be delivered by this Friday. Over half of these vaccines will go directly to large healthcare providers and local public health departments that have ordered the vaccine in packages of 300 doses. The other half will be repackaged in smaller amounts so that pediatricians, family physicians, community health centers, and other providers can immediately begin to vaccinate their pediatric patients. Since the pandemic began, we've expanded the capacity of vaccinators from 300 to nearly 2,400 providers now, all across 105 counties. Should parents choose to do so, we stand ready to vaccinate the more than 260,000 Kansas kids in this age group as quickly and as smoothly as possible. Our schools will continue to be essential partners throughout the vaccine distribution process. We know that the best way to get Kansans vaccinated is to bring the vaccine to them. I want to thank all the districts that have already expressed interest in hosting a vaccination event for students aged 5 to 11. And I strongly encourage all school districts in Kansas to host an event. Schools can contact their local health department to learn more about hosting a vaccine event. As always, logging on to vaccines.gov remains the best resource to find a COVID-19 vaccine site near you. I cannot overstate the importance of the vaccine for kids in our pandemic response efforts. Even now, nearly a year after the first vaccine was approved, misinformation about the vaccine continues to run rampant through our communities. And some Kansans remain weary of getting vaccinated or having their kids vaccinated. I want to reiterate that the vaccine authorization process is thorough. They have the best minds working to ensure that the vaccine is safe. Ultimately, this decision will be up to our parents. So I encourage all Kansans to talk with their doctors or other trusted healthcare providers to make an informed decision on what's best for their kids. The tools we need to protect our children and finally return to normal are more accessible than ever. This new vaccine is safe, it's effective, and it's free. So call your doctor or go to vaccines.gov and schedule an appointment as soon as possible. With a commitment from every Kansan, we can put this pandemic behind us once and for all. And with that, I again express my appreciation for the work group's continued efforts to bring you a real-world experience in keeping our schools open safely. And with that, I'll hand it back to Drs. Kuhlman and McKinney.
Governor Kelly, thank you so much. Really, your dedication to our students and teachers, and really just to all of our Kansas communities all across the state, urban, rural, it is very clear. Your guidance through this work group has also been very clear in wanting to help our students out there be safe, stay in school, and stay healthy. So thank you so much for the message that you brought today. We always appreciate you being on here with us. You are welcome anytime. This is your work group, so come back anytime you want. And in the meantime, we will continue to do the work that you have allowed us to do, and hopefully we can continue to help schools and students and staff out there. Thank you.
Well, thank you, Dr. McKinney. Thank you, Dr. Kuhlman. Thank you all.
Thank you.
Wonderful. Great. Always great to have the governor here. So, I do think it's nice to know that the leadership of your state is truly concerned about every child out there, every Kansan out there, because placing importance on a work group like this really shows that, that not every state is doing something like this. Not every state has a testing program in their schools. So I think we're very fortunate in Kansas to be able to do that. So, all right, well, we'll get started, I think. I believe Marcy is next. Is that right?
Terrific. Thank you, Dr. McKinney. And as per usual, we're going to go ahead and get started going through school metrics and updates, and then we will hear from Dr. Watson. So with that, Dominique, if you want to hit the next slide, please. So wanted to flag for you this week, you'll see that the daily cases of COVID continue to hold at about 800 per day. But I did want to flag this increase in deaths that you see this week. This is due to a data reconciliation process. On occasion, we need to stop and make sure our systems are synced up. So in this case, we have synced up the disease surveillance system with the death registration system. You can find all of the data online, but there is not an increase in new deaths in Kansas. This is a bit of a data anomaly. Wanted you to still see the data nonetheless, and be able to explain that to you. In terms of tests, as COVID cases go down, we see tests continue to fall, and so want to pay close attention to that. And you see here vaccinations continues to hold steady, a little more than 11,000 per day. Next slide, please. Vaccination continues to trail the national rate for youth at about 7%. We are hoping that the great news today about being able to vaccinate kids ages 5 to 11 provides a catalyst to get kids in this age range of 12 to 18, 12 to 17 to get those vaccination rates up. Next slide, please. We do continue to focus on the three major tools that are most effective in keeping kids safely in school and preventing the spread of COVID. We'll be talking a lot today about vaccination. We will continue to talk about the test to stay strategy and look forward to hearing what Dr. Watson's update is for us this week. And of course, we continue to discuss the importance of masking. Next slide, please. So offering up the testing dashboard that we share with you each week, you can see we do have more school districts continue to demonstrate their interest. 4 more have drafted testing budgets since last week, and 2 more additional districts expressing interest after initially thinking that they weren't interested in the test to stay strategy. So I reiterate my thanks to this work group and to certainly all the school superintendents and school boards out there across the state who are taking another look at the test to stay strategy and saying that it can really be effective and certainly tailored to an individual school district's needs. Next slide, please. Here you can see the vast majority of tests we do in Kansas are antigen testing. Although we had fewer school districts report, we've got 0.5 thousand who tested positive this week. So continuing good news that we are managing COVID in our schools. Next slide, please. In addition to testing, we focus on masking, paying attention to the number of school districts that have mask policies, as well as the number of school kids impacted by those policies. So here you can see sort of the primary data that demonstrates we've got about 56% of kids in Kansas schools are required to wear masks. And another 7% required for most students, but not all students. So we begin here, and then next slide, please. We contrast whether a school has a masking policy with whether the school is experiencing an outbreak of COVID. And each and every week, this news continues to be better and better. And we see demonstrated that those schools that are requiring masks see fewer active outbreaks of COVID, which impacts fewer students. So here the disparity that this week, 39 per 100,000 students were impacted by active outbreaks in schools where masks were required. That number goes up to 273 cases per 100,000 students. So bigger and bigger disparity every week. This just demonstrates the importance of masking. And we've been talking about this across the agency and in the governor's office. This simple, inexpensive strategy can go a long way into protecting teachers, staff, and students. Next slide, please. Looking at our youth vaccination rates by county, as the information on kids age 5 to 12 come in, we will certainly be tracking that information as well, but wanted to share this data with you again in those areas where you can see there are more dark blue school districts. Those school districts are experiencing better rates of vaccination. And of course, we're trying to do what we can to encourage kids in all of these counties and school districts to get vaccinated. Next slide. Which is a great segue to the conversation we're going to have this afternoon. I'm with a room full of school experts and clinicians, so I am not going to tutor you too much on what the CDC has done over the course of the last several months in preparation for vaccinating kids. But we know that the various scientists that have been reviewing the evidence looked at how COVID impacted kids in particular, and you can see topics we've been discussing for weeks now: worsening mental or emotional health, a widening of existing education gaps. We see kids being less active, and that impacting a whole host of healthcare outcomes to include BMI. We see them also getting fewer routine immunization and having an increase in what we call adverse childhood experiences, which we know ultimately have a serious impact on health outcomes in adulthood. And last week, we talked about the loss of caregivers who have died from COVID. So many, many, many reasons that we are focused on being able to vaccinate kids, that the indirect impacts of COVID are very significant. The scientists then looked at the summary of the available evidence. to determine whether kids 5 to 11 are at risk from severe illness. And you can see the numbers listed here, almost 2 million reported cases of COVID in kids, more than 83,000 hospitalizations through mid-October. And the severe illness that kids experience, of course, can be mitigated by the use of an effective vaccine. And so next slide, please. The CDC director last night, Dr. Rochelle Walensky, approved use of the COVID-19 vaccination for kids ages 5 to 11 years old under an emergency use authorization. And the CDC has an immense amount of information, not just for health professionals, but also for teachers, for parents, for pharmacists, for community partners. So these are just 2 snapshots that I wanted to share with you, so that anyone who is part of the work group or who is looking at this Facebook Live event can know that there are resources available to you right now to help answer questions that folks likely have about the vaccine. Next slide, please. I've got just 2 more. Wanted to make sure that schools were aware that there are resources available on the CDC website specifically for schools, how they can support vaccination in their own schools, or they can support vaccination by working with healthcare providers in their community. So this too is online. There are several toolkits and lots of checklists for clinicians, for community members, for schools to help them get prepared for this vaccination opportunity. And then last slide, please. This is a little technical, probably for your average Kansan, but for those of you who need a bit of a cheat sheet to understand who is now eligible for the primary series of vaccine, I think most folks are aware we've got 3 different vaccines: Pfizer, Moderna, and J&J. You can see under Pfizer and Moderna, 2 shots are what is necessary to consider someone fully vaccinated. J&J is just 1 shot. But where I think this particular slide is very helpful is it helps demonstrate that only the Pfizer vaccine has emergency use authorization right now. We suspect Moderna and J&J will ultimately be able to offer vaccination as well. But for now, it's the Pfizer vaccine. You can see here who needs an additional dose, who needs a booster dose. So these resources available for you, and Christy Clark, Dr. Clark is pointing to resources available through the Kansas chapter of the Association of Pediatrics. And that is a great segue back to all of you to talk about what this vaccine means for kids. And maybe we'll start with Dr. Watson and then hop over. Sorry, Dr. Watson, you can pretend to be a clinician if you'd like. We know that you are a doctor of education.
There is no one on this Zoom today that wants me to be a clinician, okay? But thank you, Marcy, and thanks for going over that. I want to, again, for everyone listening, put this in perspective, because if you, like I, sometimes get together with people from other states, discuss a variety of issues. Kansas is very unique in a lot of ways. And I think during this pandemic, we've been very unique. 500,000 Kansas kids are studying in a school right as we speak. 500,000. They're going to school in private and public schools. Almost 50,000 Kansas teachers and a variety of classified staff. Governor Kelly and Kansas Department of Health and Environment and all of you on this work group have prioritized educators and families and students as one of the top priorities vaccine, testing, and masking. And that is not true in a lot of other states. And by doing that, we are experiencing this year a very different environment than many other states, where most of our students are able to go to school every day and have a great education. And so I want to thank all of you for your efforts and say thank you for that. And the next phase of that is, with great excitement, the vaccines for younger students. And I know school districts are working with their county health to get ready now to spring up those vaccination clinics as we continue to try to work on those middle and high school age students, 12 to 17. Again, we continue to stress to school districts, vaccinations, as Governor Kelly said, vaccinations. That's the real way we're going to really beat this virus. And then, of course, to mitigate until we can get there, masking and testing. So I want to say again, thank you for your leadership. One of the great things I love about our state, one of the many things, is because we are small in population, we know each other on a first name basis, and we can look at each other and we can disagree. But we are all working for the same common purpose, which is, let's keep kids in school. Let's keep our staff and our kids and our families safe. And I can't thank all of you enough for those efforts. So thank you again.
Thanks, Dr. Watson. I think I'm curious. I want to just open it up to feedback. We certainly have a lot. I think a lot to discuss with vaccinations in children, and I'll just turn it over to whoever wants to begin speaking.
Looks like Kevin has his hand raised.
Thank you. Mine's less vaccination, so I hope that this is in line, but I want to talk about the masking piece that the governor and what you guys have talked about. I'm going to try to be really non-political, which isn't normal for me, but looking at the results of last night's school board elections, we had, in all the suburban areas, we talked about had masking mandates and did a lot of those mitigation efforts. A lot of candidates who have run off the platform of not masking and not doing the mitigation efforts won, and they will be on the boards in January. And I think we run through December, if I remember correctly, but collecting the data has to be a very vital, important part of what someone does, like KSDE or something, because I think we're going to see some of those masking mandates change, and we need to be able to track that. And then I'll stop there.
Kevin, you bring up a great point. Just watching social media and the news, there's it was an interesting election day. So I like to use the word interesting when I don't know other words to use. So I guess, are there any other thoughts? Because we have new school board members coming on. We have new city and county commissioners, and I think the thing to remember is that COVID is going to be with us for a while, but it also is not our only topic that school boards need to deal with, and city and county government. And so hopefully we can continue to help guide through COVID, but also beyond, because there is a lot more out there, even though COVID is kind of consuming us these days.
And one more thing, and then I'll mute myself. So I kind of did some test marketing within my own little network of social group and family, that what this work group was really proposing was using the pediatricians and family care providers of those kids that were 5 to 11 for the comfort of the families. And that's overwhelmingly been, that's a really great idea for them to do, as I've talked to people about that. So I think that absolutely is a great strategy to get the vaccines in the hands of pediatricians and family providers that are used to seeing those children. And our parents are going to be a lot more comfortable in doing that than what maybe they would do to go to a school vaccine site or something else.
And I might just piggyback on Kevin's remarks, because one question that I have heard raised, and a shout out to all of the physicians who have signed up to be vaccinators, all of the pharmacists, all of the nurse practitioners, recognizing that folks want to talk to their healthcare provider about getting their kids vaccinated, but also realizing it's going to be easier for some parents to have kids go to a school-based clinic, et cetera. In Kansas, we are doing a great job of getting providers who already participate in the Vaccine for Children program to also be vaccinating. I might just ask some of the clinicians on the Zoom call, what are the differences? If you were going to be recruiting one of your colleagues to get on board and start vaccinating kids, what do they need to know that is different to vaccinate a kid for COVID versus the regular school vaccinations?
I'll offer something. I don't know that there is a difference. I think that you don't delay things. You don't have to separate them by time. You just vaccinate. In primary care, it's the mantra that I was taught from the get-go was an opportunity to see a kid is an opportunity to vaccinate, an opportunity to protect that child. And I think that's how we have to look at this. Now, I think, and I'd ask Dr. Clark, who just stepped off, I guess. Dr. Clark has mentioned several times, though, that when we practice, in smaller settings, opening a vial and wasting doses has been a real concern. And it's really harder for smaller practices. And when you get out our way, everybody's a small practice. And so I guess I'd let Dr. Clark expand on that a little bit more, but I know she's raised that issue multiple times as we've been talking about vaccinating adults and adolescents.
Hi, this is Dr. Christy Clark. Thank you, Dr. Burns. So yes, that is one of the concerns. I will back up a little bit and say there really shouldn't be a difference, because this vaccine, the COVID vaccine, can be given with any other vaccine, including the influenza vaccine, which is also called the flu shot. So this can be given with any other vaccine. So that's the good news, because kids are getting vaccines, right? And we're on flu season, so we're getting flu shots. So that's the good news. Also, the vaccines should all be put into the WebIZ program. That's Kansas's basically our electronic record for immunizations, so that if I saw a child and gave them shots and then they came along next week and saw Dr. Kuhlman, they'd be able to look up and see what vaccinations that child has had. Also, the school systems can see the vaccines. So really, it's really the same. But I think that Dr. Burns brings up a really good point in that, because these aren't single dose vials and because they have to be used within a limited period of time, there is concern over waste. Now, the decision has been made that some waste is acceptable. So we don't necessarily have to have, like in the early days of this, a lot of times we felt, and I find health departments still feel like they have to have all 5 people, maybe even 6 people, lined up to feel like they're being good stewards of that life-saving vaccine. So that's not necessarily the case. Some waste is acceptable. What we're finding with our work with the Kansas chapter of the American Academy of Pediatrics, is we're trying to help pediatricians through this process, is that sometimes for their scheduling, they will try to cluster these vaccines into one day. So they may choose, even though they could do these vaccines any day of the week, sometimes they'll choose one day in the week where they're giving these vaccines. I've also seen health departments do that too. And that's acceptable. The main thing is that that we vaccinate people and we protect people, because the vaccine in the vial can't help anybody, isn't making antibodies to protect you. We got to get those vaccines into the arm to get the antibody created and to protect us against the Studley virus.
I guess the only point I guess I just wanted to think a little bit more about that. Well, all of this has to be done within that setting, within a doctor's office, within that one encounter. I think when we're starting to talk about, using vaccine clinics and vaccine fairs and vaccine parties, just to be able to group that usage of those vials and use it most efficiently, I think that there's a good argument to make there. And maybe that's where we have to rethink that structure and say, people still want to talk to their doctor, their provider, have them be available at those events to have those conversations, but don't maybe slow down the throughput, for lack of a better word, to wait for those individual appointments in this traditional setting of the doctor's schedule to be made in the office setting. That would be my only point.
I think that's a good point. I think you also have to take into consideration this age group too. Sometimes in the younger ages, you're going to have more just anxiety around receiving vaccinations from the children. And so making sure that you have a kind of a safe place. So if a kid does cry or react, especially the 5-6-year-olds, that you're not scaring off a large group of waiting children too. So just trying to think through those strategies as well. Certainly kids at this age too, to be incentivized for their vaccines. So making sure if you're going to give these vaccinations out, maybe a little treat, whether it's a sticker or a I was going to say popsicle, but lollipop is what I meant, or something like that, just to kind of reward and incentivize.
I know one difference that because we are in a public health emergency, not only physicians, but pharmacists can give vaccinations to kids. And that's something that we don't typically do in Kansas. So I'm going to flip the question on its head, since my kids are older. Will this feel any different for parents? So if it's not different from the perspective of the clinician giving the shot, if you're a parent, does this feel like taking your kid in for any other shot?
I don't think so. Most of the parents are used to coming in for the vaccinations and the flu shots and stuff like that. I don't think you'll probably have, looking at the people who've kind of agreed to go ahead and get vaccinated, they're just chomping at the bit to just get this over with and get it done. They see, or at least the parents that are willing to vaccinate, they see this as sort of the culmination of sort of the end that they've been waiting for the last 2 years to kind of give some conclusion to this, so that they have some control over your kid's condition. They know it's not complete, but it does give them some control over what's going to happen to their kids. And so, but I don't see it as a big difference. I mean, the office flow issue is a good question, because we're still debating how to do that, whether we'll do clinics and stuff like that, and that's basically we're going to have 2 days a week probably that we'll give the vaccine. If we had single dose vials, though, we'd be doing it every day. I mean, I don't think it'd be an issue at all. I think it would be, to me, even easier, because there's a lot that can happen when I get the patient in front of me. It's a little bit different when they have to call and and you have to kind of get it scheduled and planned. There's a lot of things that can change from that time, or even having them just make that telephone call or make the effort to do it, versus when you make it so convenient that you already got your 3-year-old here for we'll say 6-year-old in this case here for a well exam. What's your position on this? Do you have any questions? Can we do this? Education. They say yes, done. And she gets home and says, hey, I was in Dr. Mill's office, blah, blah, blah. I did that. And she's talking to the next mother down the street, and she's got, three other children that they're 8, 9, and 12 or something, so that's going to be a player. So I really hope that they look at, getting single dose vials or some way to even 3-dose vials to kind of allow us to have more utility for the vaccine. But to answer your original question, the answer is no. I don't think it'll feel any different from that. One parent came in today and she was talking. She says that if you're offering the vaccine and if I trust you, and that's the reason I'm here, then I'm going to take that into a very high consideration to get this done. And so I think that's going to be the biggest single seller is to, if you're going to have to put your reputation out on something, then this is probably something that you can do that on, because that's what we do. We're physicians and we're supposed to be experts in that. Use it, use that bully pulpit to decide that this is, you think is the best option for them. Nobody says you have to be 100% right. You just simply have to make sure that you're using the best science and the best decision making you can make for that individual that's in front of you, because every patient that comes in is an individual patient and should have decisions made on their healthcare based on what their situation is, not what the guidelines say or anything else necessarily. Take that in consideration, but for that particular individual. And that offers a great opportunity to do that. Okay.
Awesome. Thank you. Thank you, Dr. Mills. I can keep throwing all kinds of questions. As a parent who is thinking a lot about these issues, we have seen that one of the biggest barriers, and we talked about this last week, was side effects, that parents are concerned about side effects. What do we know about side effects? When I heard Dr. Clark said kids mount really good immune response, does that mean that they're going to have worse side effects than parents? And can a smart clinician talk about that a little bit?
I was going to unmute till you said smart, and then I'm just going to remute myself and let somebody else speak.
Oh, you are so funny, Dr. Coleman.
Coleman, this is all to you. Come on.
Yeah, give it to us.
Yeah, so I think certainly in the clinical trials that they did, they actually found that children had less side effects of fever and less side effects of the chills and the, I call it rigors, but kind of the chills and shakes that you can get following immunizations than certainly the adult population. So that was good. I think what they did find most commonly was kids were fatigued or tired, may have a little bit of pain at the injection site, which is very common and typical of all childhood vaccinations, just to get a little pain or discomfort at the site. Other side effects really listed are maybe some mild muscle pain or joint pain, again, probably related to that site. Again, similar symptoms and side effects that we see really after a flu shot, honestly, or other childhood vaccinations. So, yeah, it sounds like a very great, a good safety profile following this vaccination with really minimal side effects.
And I do think it's super important to, as we always do with every vaccine, to share the possibilities of what could happen. I have seen, some parents who were concerned about their kids who were 12 to 17 who got the vaccine and did have the fever and all of that stuff, and then you see people on social media saying, oh, this is terrible. They feel so bad after the vaccine, but just helping them with expectations, what could happen. And this is a good sign because your body is mounting a defense. I think that is really kind of the message we want to share as clinicians out there, that yes, you are going to probably feel bad afterwards. If you don't, it's a bonus, but that's a good thing, and they'll be protected afterwards. And it's much better than the possibilities of taking your chances with COVID and the symptoms there. So I just think managing expectations are really important throughout this whole process.
Absolutely. Absolutely. And you talked about minimizing the risk of COVID, and we know over 8,000 kids have been hospitalized with COVID in the US. Certainly we've had nearly 600 deaths, almost 100 just in this 5 to 11 year range in the United States. And we've had 5 pediatric deaths in the state of Kansas. And if you ask me, we have now a vaccine that's going to prevent that. So it should be, we shouldn't have any moving forward. Looks like Dr. Clark has her hand raised.
Yes, this is really all good input. And I like Dr. Mills' input about how patients and parents and kids, they really trust their pediatrician. So definitely I would urge parents who have questions, talk to your pediatrician, talk to your family medicine physician, talk to your nurse practitioner, talk to your PA, talk to whoever is taking care of your family from a primary care basis, and ask your questions and make sure you get reliable information. I do want to pause to remind us all that the immune response in children aged 5 to 11 was so robust that actually the dose of the vaccine is lower for them. So that's really good news. And that's something really special about children is they have a much better response to vaccines than adolescents or adults. So they actually get a lower dose. And I think that'll be reassuring to a lot of parents, knowing that this was so well tested that it's not a one size fit all solution, because kids aren't little adults. The other really important thing for us to remember is that this vaccine was approved for ages 12 and up back in May. And that was a long time ago. So my sons that are teenagers, they were vaccinated back in May, and they're still doing very well. They haven't had COVID. And so I'm very pleased with how they've done with the vaccination. At this point in the United States, in children ages 12 and up, over 10 million kids in the US aged 12 and up have already received at least one dose of this vaccine. So that is something really important for parents to know, that this isn't really something, it has EUA. It was tested in thousands of kids. There were no serious side effects, and millions of teenagers at this point have had this vaccine and are doing well with it. And so that's important for us to keep in mind and to make sure that we communicate that with parents.
So this one is a loaded question because I know many of you have double degrees, etc. But when I hear some of the misinformation that is out there and the questioning of healthcare professionals like yourselves, how many years of college did you go to become a pediatrician or a family physician? How many years did it take you to be a specialist in our health?
Let's tally.
Dr. Burns went the longest. I'm pretty sure out of all of us.
And then I did a chief year on top of that, and it just kept going and going and going. I don't know. Still learning, but if you looked at my loans, I went a long time. More than, let's see. Okay, so we all go to 4 years of undergrad, and you have to have an undergrad degree. And then medical school is an additional 4 years. And then a traditional pediatric residency and a family practice residency is another 3 years on top of that. I did a med peds residency, that was 4 years. I did another chief year on top of that, and then I did an MPH. That was a couple of years. So it was a lot. And I think we all, Dr. Watson went for a long time. Everybody, because we want to be really well trained and really well prepared. And medicine is an evolving science. When we say we're still learning, we are all really doing our continuing education. We have to do our certifications. We have to continue on this path. And so it's lifelong learning, even after your degrees are granted.
Absolutely. I think that's a very important point is our degrees, mine finished several years ago, and we still learn. We have to continue to learn to keep up with all the information and in technology and everything that comes out with medicine. And I feel like, honestly, the last 2 years, I've learned probably more than I learned in my 4 years of med school. And certainly I equate medical school to drinking through a fire hose, but certainly the COVID pandemic brought all that back to me because it was just reading and reading and reading information and information. So study after study. So it is a continuous learning process.
I had a interesting interaction with a patient this week that I think helped me to understand a little bit more about just the public's perception of vaccines. And they were very kind to come in, and this was an adult, but to ask about what I thought about the vaccines. And what she asked, or what she said was, there's so much information out there, I don't know what to believe. And then she made the comment, I just don't know if there's enough science out there. And so what we discussed then was that there's a lot of information out there, but there is so much science out there right now. There's more science than we've had for other vaccines. I mean, we're living the science right now with, over 4 billion people worldwide that are test subjects and with the vaccines that we have. So we talked about that. And that the other information out there that seems, she described it as conflicting information, just, there's so much information, but the other information is not the science. But it's being presented as the science, and it's being presented as fact. And so we have the science here and we have all the other stuff over here, but I could see how that's confusing to people, because if you don't have the education that we have to tease out, I mean, we still have to kind of be very, very diligent about reading articles about blood pressure medicines and diabetes, and just making sure that that's accurate information, cancer treatments and all of that. But we have to know how to know which piece of information is science, and which ones to follow and which ones not to follow, because they might not have all the peer-reviewed studies or whatever else. So I absolutely understand that the general public might not be able to differentiate between what they see as all these facts out there, but these facts are all conflicting. And so I do believe that it's up to us to help people, and I really hope that people do come forward and ask, hey, can you kind of help me tease this out? Because I'm hearing so many different things. It doesn't happen as much as it should, but I would encourage everybody out there, that might be listening, or everybody who walks into our exam rooms, to please ask, because we'll be happy to help with that. That's what we went to school for, to be able to figure out what's the science and what's the other stuff that's taking away from the science, and thus taking away from the safety of our kids and our communities. So very interesting. It's hard to blame people out there, because there is so much information that's just kind of the misinformation we talk about, but it's being presented in a way that is very misleading as well.
I've got a solution for that, and it sounds simple, but you need to become a really good storyteller. People like to hear things in a way, a context that they can come to some conclusion and put it in terms that they understand. So I often context everything in stories. If you think Joe Biden's really, really good at it, you should hear some of mine, but that's the best way to go. You have to get them in. It's just, everybody likes a good story. And if you can put vaccination down into a scenario where it brings down to their level, that they can see Hansel and Gretel and the bad wolf and all that stuff, and it can all kind of come together, they get it. But you got to be able to tell that story and be able to convince them that that's for the good, so to speak. They understand that, but it's all about storytelling. You got to get in there and be able to explain it in terms that they understand, and have some conviction and tell them that story, so that people understand it in your voice, that this isn't, just something you read in a book. This is something you feel like is real, and you think it's honest and true, and you want them to take it to heart and stuff like that. So you got to become a good storyteller. If you do that, it helps quite a bit. Okay.
I think that's
Coming to a television near you, Dr. Mills will be telling a little story about how he convinced his granddaughter to get vaccinated. But for any of you that want to be able to tell your story to the media, we certainly want to do what we can to get your stories out. And do please pop me an email after this meeting, because people do want to hear from their clinicians. They want to hear from people they trust. And we are happy, given how busy you are, to facilitate conversations with the media to try to get your story out in your hometown paper. Sorry, Dr. Burns, I interrupted you.
Oh, that's fine. I just think that's a really good point. And I think that Dr. Mills made, because so much of medical school and so much of residency, and now it's just a scientific analysis. We all learn to think about statistics. Number needed to treat is what we're constantly looking for. These are things that are just second nature to us. And so as physicians, I think we are always like, well, this makes so much sense to me. How can you not see the science here? How do you not? And then when we're challenged, to your point, to your question, Dr. Nielsen, about how do you feel when you're challenged about it? Man, we double down on that. We start throwing out statistics and number needed to treat and what the positive predictive value is, and we lose people. And I think that's a very good reminder from Dr. Mills. Exactly. Sometimes us trying to present our understanding of science, really, we lose.
Yes.
And sometimes residents, right, Dr. Coleman?
Yes.
Not our residents. Our residents understand everything, but
Of course.
Yeah.
I always,
Oh, go ahead.
I always say, we always talk about that in the physicians speak data, numbers, statistics, and our nurses speak stories. And so we have to bridge that communication gap, even here amongst our multidisciplinary teams in this clinical setting too, just to get the same messages, interpretation of our message out. So.
Well, one of the interesting things that I read when I was looking at the CDC website for ways in which schools could be good advocates for vaccination was not only to host clinics and not only to partner with local public health, but to really help kids understand the science behind vaccination and getting science teachers, even if it's not COVID necessarily, right? Just helping kids understand how the immune system works. And I don't know if Randy or GA or Kevin have any stories about ways in which that's happening across Kansas. But this is not just about trusting medicine. It's also about trusting science. And we learn science from our science teachers. And I was a biology major as an undergrad. Dr. Watson, you going to bite up on that one?
Well, I can bite that I was not a biology major as an undergrad. That I can tell you. So I survived biology as an undergrad because I'm a history major. So there we go on that. So when I walk into any of your offices, which I did this week with my family physician and routine physical, and I joke with him, I read on the internet. He said, yeah, I read that too. And so we joke about that because I put my trust in him. I may ask questions, but I have to put my trust in that training. And I think that's what's so valuable. Kevin can probably, we can also probably speak to the science training of it. But I think we do want young people to understand what is happening when a vaccine is developed and then is given into you. What is that response? Dr. McKinney said it well. We would hope there is some response. That's your body sending good signs that there's an immune system that is coming to life, right? That what you want to see. So I think that's great lessons.
I can give a shout out to one of our leaders, teachers down in the Wichita area, Kathleen O'Brien, who does career tech ed health pathways, that when this first came out, she was like on social media going, at last, my kids are understanding why it's so important to learn about vaccinations. So that was really pretty cool. But to your point, I think even the social emotional thing of even our elementary school children, to talk them through what's happening in their lives and how that basic science can work. I can see that. We call it teaching the moment. And I think that could be incredibly powerful. And I want to take one more point. I don't want to be too selfish, but Dr. Mills, I taught your children in Lansing High School in American history. I missed the debates with Justin, so would you please tell him I said hi?
I will. That's great. I was going to say that's what my minor was in history, so it runs through the family. My son, my other son, the same thing. So we like it.
He's very good at it, by the way.
Yeah, he was, and he still is.
This is Kimber from Wichita Public Schools, and I love everything that you've shared today, and something that I wanted to reiterate about really collaborating with healthcare providers. We have been doing our booster clinics for our staff members, and even our adults, our staff members, we encourage them to also talk to their healthcare provider, before they get to our clinic. And, when I was sitting there talking to them, do they need to get a third dose or a booster dose? Trying to explain the differences there, and having the information and the fact sheets and the data and the science, even as an RN, and just saying, did you talk to your doctor about this? Did you have an opportunity to do that? So I feel like we already do that, not just with the kids and their parents, but also with our staff members. I mean, everyone needs that connection and the trust. We're excited that we have a lot of staff members like, oh, I can't be there this weekend for my booster shot. Are you going to have it next weekend? And, they trust their doctors, but there's something about coming together too, and doing this for the good of everyone that we've seen in our district. That's been kind of exciting. So I think we'll have a mix. Like Marcy said, we'll have some parents that are going to come to our school clinics, and some that are going to go to the doctor's offices, which we can't get them all in at one place all at once. So we've got to have a lot of different outlets for people. But I definitely agree that we've got to encourage them. And I'm excited about the new KCWK parent question sheet. I sent that already to our media and communications. I said, hey, when we send out the consent forms, let's just attach this in there too, so it's right there for their questions. So I just think that it's important for adults, kids, and the parents to connect them with their providers, but also for them to feel safe to come into our schools as well, and have another opportunity for them. So it's about to get fun.
Thank you. That is super, super positive, Kimber. I appreciate it. It is going to be fun. Like, how exciting to be able to bring kids in, get them vaccinated, and have one more step toward, normal kid life. So that is very exciting and fun. Well, I think we are at the end of the hour here. Thank you guys so much for the discussion. I might end this, if that's okay, with just another conversation I had with another patient. Again, they teach me so much every time I'm in an exam room, and we have these conversations, and kind of what the result was just the discussion about that we oftentimes will feel helpless during this pandemic, whether you're in healthcare or just a community member. But the truth is that we actually do have power and we do have the ability to do something during this pandemic. And I think that's my message that I'd like to share with everybody out there is please do something. Not only do we have that power, but we also have that responsibility. While we have rights, while we have, our own decision making, we also have the responsibility to do something. And so we've talked a lot about vaccinations today, but at the same time, we know that there are a lot of tools. We've talked about the different tools that we can use through this pandemic and to get us out of here. So vaccinations absolutely are one of those tools. But if you decide not to be vaccinated, like Dr. Mills said, please make your personal decision. Every individual is an individual. So if for some reason you decide not to be vaccinated, then wear a mask when you go places. If you decide not to wear a mask, then please, don't maybe be in large gatherings. If you've been exposed to somebody, maybe, don't be around people. Please get tested. If you decide not to get tested, don't be around people. There are so many layers of things that we can do, but there's always something. There's always something that we can do. And that's the power that each of us has and also the responsibility. So when we feel helpless, when we kind of get down and think, oh, this pandemic is never ending, I hope that people listening or people out there will decide, there's something that I can do and I will do it the next time that opportunity arises. So hopefully for people out there, that decision will be to vaccinate their 5 to 11-year-olds. And next week, I look forward to seeing the data on that. Hopefully we will see that is happening throughout our state. So anyways, with that, I will say, Dr. Coleman, do you want to bring it on home?
I think you wrapped up that well. I'll just summarize it by saying do something. How's that? Everybody do something. Time to get off the sidelines. Let's do something.
Awesome.
All right. Thank you guys so much.
Thank you, everybody.